Update Reddit.
Nurses and doctors of Reddit, what is your "they never taught this in school" moment? This one was fun. Patient in gets a standard urine drug screen. Positive for ethanol, alcohol. Patient insists he does not drink alcohol. Test is repeated. Positive. Patient is very upset. He does not drink alcohol. Blood test is drawn. It's negative. We checked everything we could think of. Did we have the right urine? The right blood? It should be impossible to test positive on urine and negative on blood. Meanwhile, I finish his regular urinalysis. High white blood cell count, and really high glucose. Elevated white cells means you need to look at it under the microscope because they probably have an infection. It's loaded with yeast. The man was diabetic, obviously, and had high glucose, sugar, in his urine, along with a yeast infection of the bladder. The yeast was fermenting the glucose to ethanol within his bladder. He was the man who peed beer. So that's how Bud Light got started. I was in my first year out of family practice residency. The specialists like to sneeringly refer to us as jack of all trades, master of none. I was on call from the A normally unshakable doc was beside himself. Had a very preterm mom in active labor. And fog wouldn't let us fly her out. He was the only doc and the transferring facility wouldn't take her in transport without a physician on board, probably not legal, but we needed her to be at a hospital with a NICU and L&D, so they called me. En route I was trying to coach her to breath through the contractions. But she felt something coming out. I looked and saw a foot. So we're in the back of an ambulance delivering a foodling breech preemie. We delivered about a minute or two out of the hospital. They were expecting a mom in preterm labor. Not a micro preemie. We were met in the ambulance bay by one nurse. She took a look at me holding the baby with a blanket and oxygen and said, "Follow me." We ran through the hospital to L&D and turned on an incubator. PEDS wasn't in-house and the baby's heart rate was low. So I proceeded to intubate her. That was 12 years ago. She survived and is doing great. I wrote my program director at 4 a.m. that morning when I got back home, thanking him for all the training. I think I used 100% of my training that night. A patient being treated for HIV purposefully tried exposing staff members to his fluids. That was a sobering experience. What the F? Do you know the backstory behind this or the aftermath? Per my GF. Walking into a patient's house, home health, and almost being knocked unconscious by the smell of cat piss. The lady housed 25 feral cats but didn't let them outside because she was afraid the coyotes would eat them. Walked into a trailer house connected to a camper only to see the floor start moving. Realized it was cockroaches, not the actual floor. Nurse here. A very panicked nursing assistant came running to the desk one day saying, "You have to come see this." I don't know what this is. The NA brought me into a patient's room where she was giving a bath and points to an area on the patient's buttocks. "What is that?" I lean in for a closer inspection, when the patient starts to turn back around and says, "Is that my eye?" Sure enough, I didn't receive in report that my patient had a prosthetic eye which at some point came out of the socket and became suction cupped to her buttock. I left the room and had never laughed so hard in my life. Shame it's totally unethical and lots of other things. A pic of that would have been sensational. But I mean, totally wrong of course. Nearing completion of an air contrast barium enema on an extremely elderly patient. Out of nowhere she starts saying, "Call Rochester Funeral Home, I'm dead. Call Rochester Funeral Home, I'm dead." She repeated it no less than 10 times. Did you call Rochester Funeral Home? Wow. So many things. I think one important thing that was never taught is how to deal with a patient dying for the first time. I couldn't stop picturing his last breaths, the yelling of his family. All of it played through over and over. Hospice is tough, but it still is one of my favorite jobs I've ever done. When I was a student I accidentally degloved a patient from the elbow down. They were incredibly sick, probably already brain dead, and had one of the worst case of 10 toxic epidermal necrolysis I've ever seen. Anyway, I'm in there holding this lady's inside-out arm skin like an idiot, with the family standing in the corner horrified, and I just froze. My first thought was to kind of slide it back on, but thankfully one of the senior nurses rescued me and snipped that S off. Women will pee and poop during labor. Ribs crack during CPR, and it feels really weird. There is a market for amoxicillin amongst IV drug users. According to my patients, it's very common for somebody else to put cocaine in their urine, and fentanyl is a sexually transmitted drug. Wait, what in the world does amoxicillin do? Respiratory therapist here. How to act when we unplug the ventilator to let go a patient. Especially when the family is around. To their defense, they do warn us it's going to happen, but it's never until you actually do it that you realize the weight. I like to talk to my patients even if most are already brain dead at this point, although I did have to unplug conscious patients. That was hardcore to say the least. This gives me a sense that at least if even a small part of their consciousness is still alive at this point, they know they're not alone. I tell myself that at least from now on they won't be suffering anymore. Student nurse here. How to hide looks of shock when something very surprising or awkward occurs. I remember one time a doctor grabbed me when I was in the hall to hold something for him while he was putting a patient's prolapsed rectum back in. Awkward. Digital disimpaction. I can only imagine the partnering instructions for that. No one poop for 2 weeks, then come to class and buckle up. Lady asked me to name her poop. She was dead serious. Nursing school definitely didn't prepare me for that one. That dead people can still fart. Middle of the night, all alone with the body, and you hear that. Scared the hell out of me. From former boss, how someone looks at you when he tests positive for HIV. After his wife died of AIDS, because you were her doctor and you treated her for years. You were also his doctor, you knew she hadn't told him, and you knew that she was still having unprotected sex with him. WTF. On behalf of my husband, no one tells you how many low-income women will go to the ER, complain of abdominal pain, go through an exam and have different tests ordered because they can't afford a home pregnancy test. Not only this, but women who know they're pregnant do this because it's the only way for the health of the baby to be checked. Scrotal edema. So many things. Here's what I can think of off the top of my head. 1. Sugar is used to put someone's prolapsed rectum back in. Sprinkle it on and let it sit, drawing some of the liquid out of the tissues of the rectum and just kind of push it back in. That was fun on the job training. 2. How to put someone into a body bag with dignity, especially if they're tall and/or in an awkward position. 3. Fournier's gangrene. One day I was actually precepting a patient care tech when I was a nurse in the ER and had a patient ask me to help him dress his wound. This was not why he was in the hospital. Thinking this would be a great teaching moment, I called my tech in to learn how to do some wound care. She learned that day how to maintain an excellent poker face. 4. Never block your own exit out of a room with an actively psychotic patient. 5. How to comfort an inconsolable baby using a combination of low shushing in their ear, a somewhat aggressive swaying motion and some humming. 6. How to interact with patients and their family members on, sometimes, the worst days of their life. How to hold someone's hand when they've just gotten terrible news about their own or their loved one's prognosis. How to celebrate the often few and far between wonderful news we get to tell patients. And then how to leave that room where you may have just told a family their loved one is dead, collect yourself, and go into another room with another patient and care for them like it's just another day. Nursing is a profession where you have the sacred honor and ability to be there for people on the best and worst days of their life, to be able to hold a life that is merely seconds old and hold the hand of someone during their last seconds on earth. That's not something that you can be taught in school. If you have a patient in labor or in any painful procedure who wants to hold your hand, only then hold 2 fingers. They can't squeeze them too hard and break the bones. They still get the comfort of human touch. I've had patients in labor pinch me, pull on my clothes and squeeze my 2 fingers as hard as possible. Some are just panicked, but some seem to be angry and want to hurt someone. I calmly ask them to stop with the pinching or pulling on my clothes because that isn't helping them. These are often people who have refused an epidural because they are afraid of needles, and I understand that. I just am not going to be black and blue. I always teach the new nurses or students the 2-finger trick. This reminds me, several years back had a couple in for delivery. Asked what method of pain control they preferred. They looked at each other, giggled, then he said, "She bites me." I asked for clarification, and apparently during her first 2 deliveries, when the contraction pain became unbearable, she would take his hand and literally bite the FS out of his knuckle. They were both hip to this plan and oddly proud of it. Fast forward a couple hours and labor is getting well advanced. I look up from a vaginal exam in time to see her clamp her teeth on his calloused knuckle. She appeared to be biting with full pressure. He made a bit of a face but not a sound. And thus we ushered their youngest into the world. Contraction would start, she'd take a lung full of air and push to the count of 10 while biting the hell out of her man. It worked for them, so who am I to judge, but it made me somewhat uncomfortable.